to bestow this year's Dean's Medal to Dr. Leana Wen, a true public health hero. Dr. Wen, can you join me at the podium? Dr. Wen is the Commissioner of Health for the City of Baltimore. She leads the oldest continuously operating health department in the country, a department with a $130 million budget and over 1,000 employees. Among her very many accomplishments, she responded to surging opioid deaths in the city by issuing a blanket prescription for the opioid antidote, naloxone, to over 600,000 residents of Baltimore. This program has saved over 1,800 lives in the last 3 years. Based on these and other initiatives, Dr. Wen is seen as a national resource, testifying in front of the U.S. Senate and the House, and joining Presidents Obama and Clinton in speaking on the importance of treating addiction as a public health problem. In just a few short years in Baltimore, Dr. Wen has demonstrated that she has the vision of a leader and the heart of an activist. She has been fearless in calling out the role of poverty and racism in major health challenges, and innovative in pursuing creative solutions and partnerships to bring about change. Please join me in honoring Dr. Leana Wen. In addition, I am pleased to announce the recipients of 3 prestigious awards who are with us here today. It is important to recognize that these award winners were selected not by just our school, but by and in competition with the entire Johns Hopkins University community. As I call your name, I ask that you please stand and be acknowledged. The Heritage Award honors alumni and friends of Johns Hopkins who have contributed outstanding service over an extended period of time to the progress of the university or the activities of the Alumni Association. Please join me in recognizing a recipient of the 2018 Johns Hopkins University Heritage Award, Dr. David Celentano, the Charles Armstrong Professor and Chair of Epidemiology. Alumni who receive the Distinguished Alumni Award typify the Johns Hopkins tradition of excellence and have brought credit to the university by their personal accomplishments, professional achievements, and humanitarian service. I extend our congratulations to the 2018 Distinguished Alumni Award to our own Michael Clegg, Dean Emeritus and Professor of Epidemiology. The Global Achievement Award honors alumni who exemplify the Johns Hopkins tradition of excellence and have brought credit to the university and their profession in the international health arena through their professional achievements or humanitarian services. Please join me in congratulating this year's awardee, Dr. David Peters, the Edgar Berman Professor and Chair of International Health. Finally, I am delighted to acknowledge recipients of the inaugural Dean's Award for Distinction in Faculty Mentoring, which recognizes faculty members' sustained commitment to excellence in fostering the career success of fellow faculty members in the Bloomberg School. The inaugural awardees of this special honor are Scott Ziegler, Professor of Biostatistics, and Val Collada, Professor of Biochemistry and Molecular Biology. Scott's being a little bashful, but there you go. You'll find a complete list of these special honors in your program. I now have the distinct pleasure of introducing our Convocation speaker, Dr. Leana Wen. I have already shared a little bit about Dr. Wen's considerable accomplishments, but there are just a few more things I'd like you to know about her. Under her direction, the Baltimore City Health Department is nationally recognized as an innovator in health solutions. In addition to demonstrating leadership on the opioid epidemic, she has led such efforts as the Be More Healthy Babies strategy that has reduced infant mortality by 38% in 7 years, and the Safe Streets program that hires returning citizens to mediate conflicts and interrupt violence. She also developed a blueprint for health and well-being for Baltimore that enlists all sectors to achieve an ambitious goal of cutting disparities in half in just 10 years. Dr. Wen is an emergency physician, and a patient and community advocate. Among her many recognitions, the Daily Record named her one of the 100 most influential Marylanders, and Modern Healthcare called her one of the country's 50 most influential physician executives. In 2016, she was honored by the American Public Health Association with its highest award for local public health work, the Milton and Ruth Romer Award. And last year, in 2017, she was named one of Governing's Public Officials of the Year. Dr. Wen is an author of the acclaimed book, When Doctors Don't Listen. She has given 6 very popular TED and TED-Med talks, and just to give you an example, her TED Talk on transparency in medicine has been viewed over 1.8 million times. Please join me in giving a warm welcome to Dr. Leana Wen, our friend, our colleague, and a true public health hero. Dr. Wen.
Hello, class of 2018. What an honor to celebrate you, the public health leaders of today and tomorrow. Your school's mission is the cornerstone of public health, saving lives, millions at a time. This is the dedication to being the society's doctor. And it's exemplified through the leadership of your dean, someone I greatly respect and admire, Dr. Ella McKenzie. Please join me in thanking Dean McKenzie. We celebrate today with your faculty and staff, many of whom I've had the opportunity to work with. From former Dean Michael Clagg to Vice Dean Joshua Sarfstein, all of your faculty are exceptional role models who truly walk the walk of public health. Thank you, faculty, for your teaching, guidance, and mentorship. Graduations hold a special place in my heart. When I was in my second year of medical school, my mother was diagnosed with metastatic cancer. My graduation was the last time that our family was together. I think about my mother every day, especially as I am the new mother myself to a 9-month-old baby. And I think about her today. I think about my mother today as I see all of you surrounded by your loved ones. Your graduation is their graduation too. So to the parents, siblings, spouses, children, and all of your loved ones, thank you for being here today and every day. Dean McKenzie invited me to share some stories from the front lines of local public health. Well, you may know the nickname of the Baltimore City Health Department. We're the agency of bugs, drugs, and sex. So there's a lot of material to draw from. How about week 1 on my job, when we had a suspected case of measles in a 1-year-old? Measles is so contagious that one person who has the disease will infect, on average, 20 other people if they are unvaccinated. So we had to trace every contact this child had. Unfortunately, this was a 1-year-old with a very active social life. She attended, among other events, a birthday party at a Chuck E. Cheese, yes, you can groan, and a retirement party at a nursing home. Or how about when someone broke into one of our animal control vehicles and stole a raccoon in a cage? Well, apparently this thief quickly boarded of the raccoon because a 911 call was placed describing a raccoon in a cage being thrown out of a silver sedan. Well, this raccoon subsequently tested positive for rabies, a disease that is nearly always fatal in humans. So this turned from being a law enforcement issue to a public health one, because now we're looking all over the city for the person who stole the raccoon to give them a rabies shot to save their life. On a serious note, let's talk about the opioid epidemic. Last year, here in Baltimore, over 700 people died from overdose. Addiction affects every aspect of our community. And science is unequivocal that addiction is a disease, that treatment exists, and that recovery is possible. Yet nationwide, only 1 in 10 people with the disease of addiction get the help that they need. For what other disease would we ever find this acceptable? Would we say, sorry that you have cancer, but only 1 in 10 of you can get chemotherapy? Or that we should have you put in jail for your diabetes and deprive you of needed medical treatment? There are injustices and inequities everywhere we look, from pervasive stigma to the disparities that are manifest in the 20-year difference in life expectancy across neighborhoods in our city. But for us in public health, we don't just accept the status quo. For us in public health, inaction is never an option. In Baltimore, we got legislation passed such that in October of 2015, I issued a standing order, a blanket prescription for the opioid antidote naloxone to all 620,000 residents. It was the right thing to do, but still a little nerve-wracking to put your signature to 620,000 prescriptions. We quickly discovered, though, that changing policy is necessary but not sufficient unless we provide services to meet people where they are. So we began naloxone trainings in markets, in churches, on street corners. We mapped out where overdoses were occurring to do outreach in real time. And we hired people who are in recovery themselves. In 2.5 years, we've conducted 39,000 trainings. And our most recent data, updated this morning because we believe in data, show that everyday residents have saved 2,072 lives of family members, friends, and fellow human beings. This is my first piece of advice to you graduates. Don't wait. Don't let perfect be the enemy of the good. There are some who have criticized my naloxone program by saying that it's only a short-term fix to the complex problem of addiction. And they're right. We need to work toward longer-term solutions. And we're doing so by starting a stabilization center, a first-of-its-kind urgent care, or ER, for addiction, and changing our criminal justice system to treat rather than incarcerate. And we have to do even more to address the social determinants that fuel ill health and despair, like poverty, unemployment, and homelessness. But while we wait for societal change, how many more people will die in front of us? We have to save lives today for there to even be a chance for a better tomorrow. In public health, the problems we face can seem overwhelming. But we must start somewhere because there will be something we can do right now. Don't wait until you have the most well-researched paper or the perfect job, though this is your graduation day, so I do wish you both of those things. Go beyond studying the problem. Be the person who steps up first. Find what you can do and do it now. My second piece of advice to you: don't let others tell you what public health can or cannot do. There are those who told our predecessors that they shouldn't dare to take on the tobacco industry, or that public health has no role in automobile safety or environmental regulation. Well, how many millions of lives are saved today because public health leaders took on those industries and refused to be silenced? Nowadays, There are those who tell us that public health has no role in violence prevention. Really? They haven't treated patients in the ER to see how gun violence is undeniably a health issue. They're not seeing the science that violence spreads like a contagious disease, that interventions like Baltimore Safe Streets program work to mediate thousands of conflicts that otherwise would have resulted in shootings. And they haven't read Dean McKenzie's acclaimed body of research on injury and trauma. But how about going further upstream? A study from the Bloomberg school found that as many as 10,000 of our city's children needed glasses and weren't getting them. 2 years ago, with partners including Johns Hopkins, we launched a program to provide vision screenings for every child in Baltimore. And for all kids who need them, we get them glasses free of charge right in their schools so that they don't have to miss work or they don't have to miss class and their parents and caregivers don't have to miss work. That's meeting people where they are, acknowledging that nobody should ever be priced out of a basic health intervention. This program, by the way, is called Vision for Baltimore. Other names that were top contenders included Glasses Half Full and Sight for Sore Eyes. Who says that we can't have fun in public health? Although you can tell me about the fun in store for you when you toast your non-sugar sweetened beverage, non-alcoholic beverage after driving at or below the speed limit to your destination. It's been said that public health works best when we're invisible. But if we are invisible, nobody else will make the case for us. And then what happens? When it comes time to decide the budget, public health will be the first item on the chopping block. You need to be that constant voice to talk about how eliminating preparedness means uncontrolled outbreaks, how gutting Medicaid has devastating impacts for pregnant women and children and generations to come, how cutting corners in environmental health is called Flint. You have to put the face on public health. It would be nice if doing good research and running great programs is enough to convince policymakers. It's not. As Senator Barbara Mikulski says, data validate, they don't motivate. You need to be the motivator. You need to make public health visible. You will face setbacks along the way. Last July, Baltimore City received notice that our 5-year grant from the U.S. Department of Health and Human Services for teen pregnancy prevention would be cut 2 years short. This was a $3.5 million reduction that would eliminate evidence-based, science-based reproductive health education for 20,000 middle and high school students. Despite many requests, we received no explanation for the cut, though you can hazard your best guess. Our staff were outraged, shocked, and discouraged. But there is no room in public health for pessimists. There is no room in public health for passive observers. So, the city of Baltimore filed a lawsuit against the Trump administration. And last month, we heard that we won. We have to take action, and we cannot let anyone else limit the reach of what public health can or cannot do. Here is my third and final piece of advice. Stand up and speak up. These are challenging times we live in. Many of us in this room are immigrants. I was 8 years old when my parents and I came from China to the U.S. A few days before our immigration status was going to run out, we were granted political asylum. If we weren't so lucky, I would have been a dreamer. I don't know where I would be now, but I'm pretty sure that I wouldn't be standing here giving your convocation address as the Health Commissioner of Baltimore. Every day, we advocate for policies and deliver services that peg us to a particular ideology. For me, that's expanding needle exchange, providing the full range of reproductive health care, suing President Trump. I've been told to go back to my own country, which is the United States of America, and there have been death threats delivered to my office and to my home. But being a public health leader requires the willingness to stand up and to speak up. At a recent community event, someone asked me to explain the opioid epidemic. This gentleman was in his 40s, and he asked me to explain why the opioid epidemic is suddenly this crisis, this epidemic, this public health emergency, when there has been a state of emergency around opioids his entire life. And you know what? He's right. When addiction affected poor minorities in inner cities, it was seen as a choice, a moral failing. So if they end up incarcerated or dead, it was their fault. But now that addiction affects white, affluent communities, it's called a disease. Don't get me wrong, we need far more treatment for this disease. And this understanding is long overdue, but we cannot begin addressing this issue unless we are honest and speak the truth about the structural racism and the deep-seated inequities that got us to where we are. We must speak the truth that there are entire generations of Black and brown people to whom we owe an apology. And we must speak the truth that just as poverty and violence are public health issues, racism is a public health issue. Now, these are not easy things to speak about, but you must do it. Public health demands courage. Public health demands speaking the truth. Today, you are being conferred a prestigious degree from a prestigious institution. In fact, I'm reminded, the #1 school of public health. All of you have worked hard for this privilege. But along with the privilege comes the responsibility to take risks and the courage to follow your conscience. Standing up for public health, for the public's health, means that you will always be on the right side of history. I'd like to end today with a quote from civil rights activist and scholar Benjamin Mays. I only have a minute, 60 seconds in it. Forced upon me, I did not choose it, but I know that I must use it. Suffer if I lose it, give account if I abuse it. Only a tiny little minute, but eternity is in it. Graduates, public health practitioners, academicians, and leaders, let's take the minutes that we have. Don't wait. Let's take action now. Don't let others tell you what public health can or cannot do. Let's make the case for how public health saves lives and counters disparities and injustice. Don't hesitate to embrace the challenges and the risks. Let's stand up and speak up and serve with courage, action, and urgency. Thank you for the honor to join you today on this amazing, joyous occasion. Congratulations to Dean Mackenzie, faculty, and staff for carrying on the tradition of this remarkable institution. Congratulations to the parents, friends, and family for supporting these dedicated public health leaders. And to the graduates, I applaud you, I celebrate you, I cheer you on in your journey to save lives, millions at a time. Congratulations, class of 2018.